Good morning and good afternoon, everyone. I would like to welcome you to the webinar, Small Water Enterprises for the CEO Update on the State of SWEs during COVID-19. I'm Matt Painter, and I'll be your host for this webinar, and very excited to bring together 4 CEOs from the small water enterprise space and a conversation moderated by Aswad Chanda. And now I'd like to pass it over to Mr. Aswad Chanda. Aswad is the Water and Sanitation Division Manager at the African Development Bank, and he will be managing the session. Thank you. Over to you, Aswad.
Thank you very much, Nat, and welcome to the panelists. Welcome to the different participants in the different parts of the world. This is really exciting that there is such great interest in the safe small water enterprises around the globe. We have a fairly good participation, and as I moderate, I look forward to your participation, your active participation. The panelists are waiting to respond to your questions. Now, we are in a very unprecedented times with the COVID-19 situation, pandemic, and water is a first line of defense in controlling the spread of COVID. And we have seen and heard quite a lot the struggles, the difficulties that the different users have faced in addressing or in meeting these challenges. Today, we want to look at the safe and small water enterprises to see how effective they have been in public health infrastructure solutions in resolving this challenge of COVID-19 pandemic. We want to see, can they demonstrate their immediate or on the ground, the results in sustaining service delivery during COVID-19. That is a discussion that we are going to have this morning or this afternoon, depending on where we are. And we have a very excellent panel of 4 CEOs. And I'll quickly run through each of the 4 CEOs so that we can begin the conversation. I have John Allen. John Allen is the CEO for Waterfall. There is John. John started business administration in North Carolina. He has been in supply chain management, and for 10 years, he has been on the operation side of the organization. He joined as CEO of Waterfall, and he is excitedly leading the team towards the vision of clean water accessible to everyone in Central African Republic. Now, if you know anything about the Central African Republic, it's not the easiest of environments, but John will tell us how he is succeeded in doing that, and particularly in these very difficult times. Next, I have George. George is the CEO for Water Mission, which is based in Charleston, South Carolina. Water Mission is a non-profit Christian engineering organization that is providing sustainable, safe water solutions. And the company works in developing countries and disaster-impacted areas. His experience is quite broad across the globe. He's been to Afghanistan, Belize, Dominican Republic, Guatemala, Haiti, Kenya, Indonesia, Malawi, Sri Lanka, Uganda, Pakistan, and a few others that are not mentioned. The mission, the Water Mission serves all people regardless of age, faith, gender, race, or faith. Let's welcome George to the discussion. Next, I have Matt. Matt Hagen is the president and CEO of Waterfall. He's a career development worker based in Togo, West Africa, where he has lived for 5 years and joined Waterfall in 2011, and he has been in the leadership of Waterfall since 2016. Now he is the CEO and president of Waterfall. They are looking at working with communities in Togo, trying to desire to put financial and technological sustainable solutions, in the hands of the communities, in the hands of the local businesses, you know, and their vision is that every home, every clinic, every school must have access to safe water and reliable water in that country. So let's welcome Matt, who is our third panelist. And finally, we have Kat. Kat Sunderland is the founding CEO of Safe Water Network, and he has got quite a broad background. He is applied both the private and not-for-profit experience to develop the organization's market and growth strategies. You know, his business models is looking at considerable challenges and the fragmentation that is there in the market, particularly at the bottom, you know, and looking at ways of supporting that base, you know, to ensure that the field initiatives and market development takes place for increased access to water. He has worked in Accra, New Delhi, and New York City, where they have offices, and has been involved in a number of countries in East and Central Europe and Central Asia, where he has worked with civil society, transition governments, and so on and so forth. He has got degrees from Carnegie University, Kellogg School of Management in Northwestern University. So let's welcome our four panelists who are going to help us in responding to these Kat. Okay, we're missing one panelist, George. I've not introduced George. How did I skip George? I'm sorry. George, can you show the video, please? Okay, it will come on. A little bit of a challenge. George is the CEO and president of Water Mission. I've introduced him already, but we seem to be missing him on the screen, but he is there, I'm sure. Okay, good. Now, let's make a start. And I think as we go forward, what we're going to do is we're going to have a number of discussion sessions about two major ones. We'll be posing questions to the panelists and getting responses. And then this is the moderated session. And then at the end, we are going to have Q&A session. So you have opportunity, as Nat has indicated, for you to indicate your question in the Q&A part of the Zoom. Please don't use the chat, use the Q&A section, and you can't raise your hand, unfortunately, but let's do that and do that quickly as we have the questions. Okay, good. With that, I would like then for us to begin having our conversation. And let me begin by posing a question to all the panelists here and just wanting to find out in one sentence, could you please tell us what is, okay, before I go to that, let me get back to Nat and get the responses, because this question, before I pose it to the panelists, it was posed to all of you participants. And let's see what the responses have been. Do you know about the safe or small water enterprises or not? Nat.
Thank you. Thank you, Oswald, for passing it up. And it does look like we have overwhelming number of people do know what a smaller safe water enterprise is. So that's exciting. This is something that we as a sector have been working on for the past decade or so, raising the profile of small and safe water enterprises. What I personally think is very exciting about this approach is the range of approaches that fall within the SWE space. As you mentioned, from CAR to India to Haiti. So I think it would be useful to take a few minutes to hear from the panelists on how they're defining SWEs within their programs. So back to you, Oswald.
Thank you very much, Nat. And it's good to see that many of you participants know what SWEs are, but we don't know from what perspective, because these can be in various forms. So let me ask from the panelists just to help us. In one sentence, what is an SWE for those in the audience who may not know the model, and why is this different than other options to meet the safe water standards of communities without access to water? Let's go, Kat, would you like to give it a first shot?
Sure. And the variations of the model within our operating context, there's two very distinct approaches. One of is more of a micro-utility model, large overhead tank, piped water infrastructure distribution to the community, to households, to sub-distribution points in clinics and schools and so forth. Another, which is a smaller scale proposition, which is in the context of India, where it's more of a water store format, where people come and fetch the water and it's available on demand 24/7. What's in common across them all is an economic proposition, a model that people pay for the water, focus on financial and operational sustainability so that there's understanding throughout the value chain of incentives for performance and participation and water quality. That's more than a sentence, so I'll stop there.
That's very good. Two key words there: operational and financial sustainability, people paying for the services. Okay, John, would you like to come in? What's an SWE?
Yeah, so we've actually had a community of practice of different organizations who've been, working together to try and harmonize some terminologies and some frameworks around what a SWE is, so that we're speaking a common language. And Kurt, I think, highlighted kind of one end of the spectrum, which is a number of the organizations who are part of that COP are doing direct sale of water, either through these micro utilities or actual delivery of water in some of these more peri-urban contexts. And then there's a smaller subsection who are more focused on like a service delivery approach and working in a much more rural context. So for Water for Good, for example, we're taking more of a enterprise-based approach to service delivery, to servicing community hand pumps that are serving rural communities of about anywhere from 100 to 500 people. Working more closely with the management committees who are overseeing these water pumps, but taking a professionalized service delivery approach focused around preventative maintenance and repair. So again, there's a very high focus around financial viability and professionalized operations.
Thank you very much. Service chain comes very key there. Within the service chain for service provision, there are various aspects and elements that each of you is taking up. Any quick thoughts, George?
Yeah, thank you. And as you look at the models that we've been intentional about investing when we talk about small water enterprise, safe water enterprise, there's really a deep robustness that's focused on sustainability, not just from a water flowing, but from an ongoing financial revenue generation to pay for things over time. And I think that, that intentionality and going deep and looking at how that can be self-sustaining and how those models can be resilient is an area of key focus that we've all had as organizations, and we've all been able to see that pay off when we've hit these hard times as well. So, but those are just my 2 cents.
Yeah. Okay. So that's very good. So maybe very quickly, Matt, why is this so different from the other options?
I think what we're all trying to do is leverage the resources that are available in the places where we're working. That 3.16 billion people don't have safe water, even if they have piped water. And I think all of us recognize that the scale of the problem is too large to count on continual subsidies or charity to solve it. And I think it's a representation of a movement that's saying to keep up keep pace with the scale of the problem, we're going to have to be innovative and create new ways of thinking and new approaches. So it's all about providing dignity to the clients that we serve and affordable, sustainable solutions that are going to be future oriented instead of just focusing on the present.
Excellent, excellent. I think you all done very well, because those are the key words that we're looking for, particularly during this COVID pandemic, when everyone is being tested, every business, you know, and if you can use innovation, if you can use creativity to move forward, I think it makes a huge difference on what happens on the ground in terms of continuous access to safe water. So well done, excellent. Let's go to the second question, and that is, what is happening on the ground? Maybe let's try and zero in. What is happening on the ground during this period of the COVID-19 pandemic? What are the two biggest challenges that you are facing, or that you faced in the first month of the outbreak, you know, with all the lockdowns, with all the policy pronouncements from governments about no cutting of services, and what challenges did you face, and how did you address those challenges? Maybe we can begin with George. Could you just come and
thank you, Oswald.
Operational challenges?
Yeah, so I would say that, and I think this speaks for the group, that overall, the safe water enterprise, small water enterprise operations that we had in, we actually didn't see a drop-off in production or in financial revenue for these individual projects. And I think a lot of that has to do with just the decentralized nature, and also the independent functionality that they're relying on their own operations. You know, the bigger impact that we saw was more around how do we as an NGO, how do we operate in the various countries where we're supporting these groups on an ongoing basis. And you know, some of the things that you experience, they vary drastically depending on what country you're in. And so we have 9 countries that we operate in around the world. And as an example, in a country like Peru and Honduras, in Latin American areas, we saw almost a complete shutdown. And it took a lot longer to see things start to open up, whereas our operations in Tanzania actually sped up. We didn't see any kind of restrictions or limitations that were put on us. And, you know, so as you think about the impact, you know, how do you travel? How do you do business? The curfews that we experienced that limited our ability to be out in the field are one way to think about it. But the other area are curfews on things like banks. I know in Honduras, our program had an issue where we were only allowed to be able to go to the bank every 2 weeks. And I think this is actually still in place. And it has to do with the last digit of your ID card of when you can go in. And when we go to the bank, the line to get in is like 3 blocks long. And so it's just there's just a huge congestion around how you operate on a day-to-day basis that we've had to deal with. But again, it's really country specific, and we haven't seen it be the same across the board. And learning to operate and kind of roll with those kinds of things, and how do you continue is a key thing. So yeah.
Yeah, great. I mean, there was a panic response on the onset of the COVID-19, and we saw all those things. And it's good that somehow you adjusted and adapted to the environment. Matt, could you just share with us some of the 2 biggest challenges you faced in the financial aspects of your work?
Sorry, Oswald, did you ask that to me? My internet blipped right in that moment.
Pardon me?
Yeah, yes, to me. The 2 financial aspects that we face.
Yeah. Just the 2 challenges in the financial aspects of your
Sure, and just to clarify,
the demand or the use of funds, or what did you observe, and how did you overcome?
Just to clarify, in my introduction, I started out in Togo in 2008 as a development worker, and Waterfall now works in 14 countries across sub-Saharan Africa. So we have a pretty broad focus, and most of the work that we do is in rural, small township focus with pipe water and hand pumps. So looking at the financial sort of ramifications of our fee-based water delivery, and we do prepaid based on volume, and then monthly service around hand pump water with service contracts like John and what our Water for Good does. The biggest things we saw was a huge currency devaluation of 50% in Zambia that's happened over the last 3 months, which dramatically affected our sales revenues. In Sierra Leone, we've seen some drops in sales, but we're in a capital infrastructure expansion stage. And then, of course, in Ghana, the government mandated a free water movement in response to COVID-19. And so trying to have multiple mitigation strategies that are rolled out at once to make sure that we can provide water and anticipate revenue goals while making sure that we're not having our water sites be disease communication vectors and increasing costs to try to put hand washing stations and disease transmission mitigation plans in place. So it's been a complex financial environment to try to operate in.
Yeah, excellent. But it's good that despite the challenges, despite the complexity, you quickly adjusted and adapted to the environment and have been able to move on and sustain the operations and the finances. That's excellent. John, from the consumer perspective, what were the challenges from maybe what the consumers saw or thought regarding paying for water? Was there increased consumption? What challenges did you observe in the first month of the lockdown?
Yeah, thanks. In the Central African Republic, because we're working in such rural and remote context, I mean, obviously our the first thing we wanted to really focus on is how do we make sure we're responsible and acting responsibly as an organization. So putting protocols in place for our teams who are going around and interacting with 1,800 rural communities that's impacting around 800,000 people, and making sure that we're not creating an issue with teams traveling from the capital city where there's the highest level of cases reported, and bringing that into a rural community context. So making sure we're very diligent about putting policies and structures in place. In terms of the consumer aspect, working with these remote water committees and providing ongoing servicing to their water points, we built a lot of trust because we've had 15 years of engagement with these communities, including through a civil war. And in many cases, we were the only organization engaging with a lot of these communities during the civil conflict, about a 3-year period from 2012 to 2014. So we built a really strong rapport with those communities. They understand what we're trying to do and how we're doing it and why we're doing it the way we're doing it. And they understand the consistency of the service. So the goal is for these teams to interact twice a year with all these different communities and with all these different hand pumps. And so we've actually seen, a steady increase. The only time we stopped charging for the service delivery that we were providing was during the Civil War, because it had such a large scale economic impact on the entirety of the country. We've seen steady increases in terms of community contribution every year since, and this year is no different. We've actually seen an increase in community contributions year over year from last year, despite everything going on with COVID. So I think from a consumer aspect or a perception standpoint, everyone in these rural communities realize the value of water and the importance of that service in order for their community hand pump to continue functioning. And that's only increased with COVID, but it's not even, COVID is not the reason that they're finding value in it. Like they have a list of other reasons why they find value in it prior to COVID being there, and which will still be there after COVID is no longer a big issue.
That's good. That's good. The community trust was a big thing. Now, Kate, listening to all these things, I'm sure from the policy, the public policy side and the government side, there must have been some issues, related to relations and all these things. What was your experience? What were some of the challenges that you faced?
Yeah, thank you, Oswald. I think I'd answer this maybe in two ways. One is immediate challenges, and then secondly, just a sustained program to address policy issues that are real challenges to success within this small safe water enterprise sector. And so if we talk about the immediate challenges, Matt had already mentioned about free water in Ghana. A mandate came from the president, and that creates all kinds of challenges as it relates to, one, just the financial sustainability and ensuring that there's the funding available to sustain the local operations. And then also as a precedent for how we establish expectations among communities and participants in the communities about this willingness to pay and commitment to pay. And we've worked, all of us collectively, I think, as organizations have worked very hard over several years to establish this market-based approach where there is recognition about the need to sustain it, the need to ensure that there's payments throughout the value chain, and that people recognize the benefits that come from that. So there's a real challenge around that. If I were to step back just a little bit from that and talk about policy points and creating an enabling environment, I think that there's a lot of work going on, and this is collectively with a number of. John had mentioned a community of practice, which we're all members of, and others. And in India, there's a small water enterprise alliance that we've played a large role in advancing, specific to policy issues in India. And I know there'll be material and links to a lot of this information at the end of the session. But the key areas of focus would be pricing that ensures sustainability, concession agreements with communities and with local governments, and ensure that there's mechanisms for ownership, standards for water quality that work across the sector so that we're all operating to some standards that are understood and accepted. And then, where and when it's required, some mechanisms for subsidies so that the funding flows are going to benefit those most in need. So I would just say, overall, and these all play into, big theme today, which is sustainability and resiliency, getting those pieces right, ensuring a common voice across the sector, working together to influence policymakers, Africa Development Bank and other large funders of this kind of work so that we can advance a more strong response to the need.
Okay, thank you. Thank you very much for that elaborate response. I think these are all very key and important points. Participants, let me encourage you to pose questions. If there is anything that is not very clear, please post your questions in the Q&A, and we will have time to respond to those questions. At this point, let me ask Nat to conduct a second poll. Nat, please, come in.
Terrific. Thank you, Oswald. Thank you, everyone, for that initial conversation there, which is really, getting at some of the critical challenges and opportunities on the ground. Just to reiterate, please do post your Q&A into the Q&A function, as Oswald was mentioning. And while you're doing that, I'd like to move to the second poll, which, in your view, the view of the attendees of this, what is the most salient impact of COVID-19 on safe water access? And so I think we'll be taking a look at the results of this a bit later. But if you can take a few moments to take a look at the options that we've put up here, but really most importantly, we'd be very interested in what you see as other. What aren't we capturing as we consider the impact of COVID-19 on safe water access? And how else might we start to address that in as we go forward under this current crisis? So Oswald, while people are finishing the poll, why don't I pass it back to you as to continue the discussion among the panelists.
Thank you very much, Nat. That was excellent. Yes, I think the discussion is getting interesting, and the different perspectives. I think from what has been coming out, I mean, the need for is the sense of ownership of the community. So they see the need to pay for the services. That is driving sustainability of services, which is quite quite difficult. Any one of you would like to maybe speak to any of these aspects from your own experience?
Yeah, I'd be happy to. And so, you know, you mentioned this idea of financial sustainability and the price point for water, and these comments about a mandate of free water. You know, I think that the things that we've been able to experience and the models that we've been able to implement, at the end of the day, there's local ownership and indigenous ownership of the reason that there is a need to pay for water, and what's the structure behind where that money goes. It's not going into people's pockets. It's going into long-term investments for continuing to see things operate. And when that is, when that hits on the local level to a point where it's understood and it's embraced, what you see are that they become the advocates within their community, with their government officials, for combating some of these things around, you know, fixing prices and making water available for free, that at the end of the day could just completely cause projects to fail and fall apart. And so I am, you know, as we look at the importance of the kind of work that's taking place in these groups, it's super critical, and it points to again a resilience that is needed within the sector. And as we look at what needs to happen in reinventing how we approach things, you know, I think that coming out of this COVID time, there's going to be a lot of successes that can be pointed to as a result of robust models that we're now seeing stand up against these kinds of issues.
Very, very quickly, and any one of you can come in on this, because one of the challenges that the utilities face is the lack of transparency and accountability. To what extent did this contribute to the continued paying for the services by the community? Anyone of you, very, very quickly?
I'll jump in quickly, and I'd be interested in you know, comments from this. Well, I think one of our responsibilities as an organization, but as a sector, group of implementers participating, is to ensure that we're providing more information back to communities, back to government, around, you know, the financial proposition, the financial model, where the funding flows, where the soft spots, what's working, what's not. And I think, you know, I would just say that there's work to be done in that area. As a sector, and how do we have some common reporting frameworks so that we can, in fact, speak in a more coherent way around how successful we are delivering the reliable water, safe water, meeting financial targets. And I do believe as we get better at that as a sector, we'll be able to also be in a position to influence the funding flows in a more significant way as it relates to how this is a more cost-effective solution in certain instances than, for example, big investment in large pipe infrastructure, which tends to be you know, more the focus of the big funding flows. And how can this be as a complement to those government priorities and government funding flows? So that's, I think, work for us to do. There's been some important progress on it, but I do believe that's a critical agenda item for us as a sector to advance going forward.
Thank you. Thank you very much. Okay, let's move on to the second set of questions. And at this point, I just want to find out, you know, what has made the SWEs, okay, excuse me a second, please. Okay, what has made the SWEs to be a first line of response, you know, in real time? And can you give some examples from what you have experienced, say, for Togo, Matt?
Yeah, I can describe that in some locations. Waterfall's had a big push, if I can speak to Ghana, trying to have district-wide coverage in Wase East, a district there. And one of the things we focus on in every country is the same thing that John highlighted, is being highly embedded in communities where we serve. So we're businesses operating as water vendors, but we're also taking a traditional community development approach through a market lens. But having trusted relationships in communities, so being able to go out quickly and meet with people to assess and address problems they have, So how can we make sure that you're safe? How can we get connections accelerated at clinics that are locally and now under pressure where healthcare workers lack not only PPE, but access to safe water to wash their hands between patient visits in an era where we don't know what the spread of COVID is on top of other things. And I think many of us are really fortunate to have good funders and donors. We had partnerships with the Hilton Foundation and Vox Impulse that, rapidly responded with us to be able to make healthcare connections possible to get ahead of a potential spread. And then I think one of the other things we have the opportunity to do is to, coordinate with governments in a great fashion. And most of us are operating in ways that are public-private partnerships in high coordination with governments. We had WASA East asked us to create a water system as an extension of one of ours at a COVID-19 hospital that they'd set up. And then in Kenya and Sierra Leone, we were asked to roll out hand washing stations that would be managed by enterprises in really dense urban areas too. So it's been good to feel like we could do something quickly and rapidly in the midst of the pandemic because of our models.
Thank you. That's excellent. The responsive, I like the responsiveness, and the flexibility. John, from your model, what has helped your organization? What aspects has helped your organization to respond to the COVID-19 outbreak challenges?
Yeah, thanks. I think if we were to look at, the COP in general, we have a mix of nonprofit businesses and we have a mix of social enterprises where there's different types of focus on return. But at the end of the day, each of these enterprises are providing a vital resource in general, and then it gets highlighted exponentially in times of like a pandemic like this. But there's nothing like a good crisis to really test your business model, right? So I think it's been a good trial period for all of the organizations involved in this SWE framework to really internally assess, like, what are we doing and how are we doing it, and make some rapid corrections where necessary. Because what we're doing has a high level of importance on the impact of the communities that we're trying to serve. And so looking for efficiencies and ways we can do things better, ways we can respond better to the communities and to the people that we're trying to serve as customers. And how can even taking care of our teams, like how can we make sure our staff are safe in all circumstances, not just in a pandemic. So really using this as an opportunity to internally do some self-evaluation. But then I think it'll be interesting because when you come on the back end of this, the organizations that have survived this and are able to share what kind of reach they've been able to have and what kind of effective manners, I think will be really something to celebrate and to look at in terms of, as Matt highlighted earlier, like all of us have really highlighted, like the sector really needs new approaches of how they're looking if we're going to hit SDGs. That's regardless of COVID-19. The sector of WASH, in order to reach the SDGs, needs to look at new innovative ways. And I think looking at that through the lens of a pandemic is a good starting point, but I think the sector needs to look at it beyond the lens of a pandemic as well. But getting back to the original question of what are some aspects of the model, I think just being localized, having local leadership in place, having local ownership. If you look, every country around the world has been impacted by this pandemic. Every business in some way has been impacted by this pandemic, whether it's some friends I have who run a restaurant here versus people trying to do consumer goods versus people trying to sell and provide access to clean water. I think at the end of the day, if you have strong leadership over that business, you're going to see who is able to adapt to the circumstances to continue providing a service that is wanted and needed by the communities. And then in instances like Ghana, where you have to adapt now, like oh, the thing that we are using for revenue generation is now being told it's given for free. Looking at how do you supplement that? So negotiations with governments, for nonprofit organizations, we're fortunate, especially in the U.S., to have access to private philanthropic capital that we can help provide a bridge. But I think the biggest for me, I think in terms of critical aspects has been having local decision making to make sure that we're doing things effectively, safely, and appropriately in the context that we're working. Not trying to push it from the top down, but really letting the field staff have that ownership.
Yeah. Thank you very much. I would like maybe at the end, someone could come in and make a comment on, was there any situation, any place or any country where free water was pronounced and the communities refused and said, well, if we stop paying for water, we're not going to have water at all. But for later, let me go to George now and ask for what are the critical strategic measures that you want to put in place to mitigate the impact of COVID-19?
Yeah, I think this has had us, and other folks have already mentioned this, take a serious look at how we work and models that we have, the equipment that we're using, and I know that we have a disaster relief component to the work that we do outside of the small water enterprise, safe water enterprise, and so we actually activated that in a significant way. And ended up installing so far over 5,000 hand washing stations. About half of those have gone into refugee settings that are household level. And the other half are large volume and looking at how can we improve hygiene issues at water access points. And they've also been rolled into hospital clinics and into prisons and other areas as well. But specifically within the projects, as we think about how have we taken hygiene as a component piece of our work when we go in with a project? I'd say in the past, we've done that, but it's almost felt like we've been kind of just checking a box. And so we've seen that there's a real opportunity to go deeper and have a much more robust program around that. Some of the things that we're looking at are water access points. How can we make those hands-free as we move forward? And as you think about, if you've got something that people are touching, that becomes a point where diseases can be spread. And so there are a number of areas like that we've looked and looking at how we can hone in and be more effective in the work that we're doing. And then the other thing too, I think, is that, coming out of this, when you are in a disaster, you see the best and you see the worst of people. And as you think about the relationships that we've been intentional about trying to develop, we've been able to see some real deepening of relationships with government agencies where there's a broader level of trust in what we do and what we're trying to accomplish. And that's something we see there's a lot of potential to build on as we move forward too.
Okay, Nat, I'll be coming to you to give an opinion on what you see or what is needed in the sector, to support the work of SWEs. But let me quickly just get an opinion of what the collective vision is from the panelists, for the SWEs, because they are doing an excellent job. Participants, you agree with me. These are very difficult times to navigate through and ensure that you are maintaining both operational and financial sustainability of the operations. It requires quite a lot of innovation. But let me quickly get around on the collective vision, for scaling up this work in its different, in its diversity, so to speak. Who is going first? Kat?
Yeah, I can answer that a lot of different ways. I think it comes back to some of the earlier things I was saying about policy and working collectively as a sector to really make a much stronger case for funding flows, get the right kind of policies in place. I don't want to repeat all that was said before on that, but I'd say collective action. How are we organizing and responding together with a solid evidence base of success? Final point I'd say is that the COVID world has just really reinforced how important water is from a public health perspective. 25 plus waterborne diseases that we're focused on addressing, just routinely. Leave aside COVID. I mean, just think about that as frontline vaccination for these communities if we can get them safe water, and then getting the right response from COVID. How can you, unless you've got functioning healthcare facilities, safe water being an essential part of that, the right kind of hand washing. So bringing more attention, back to your question, bringing more attention to water as a public health priority, not just a nice thing to have if we can get to it, but an absolute essential priority for communities to thrive, and make sure we've got a really strong agenda working across the sector to make that case.
Excellent. Matt.
Yeah, totally.
Quick.
Agree with Kurt.
Very quick.
And, the decentralized approaches that we're taking are so vital for stability during these sort of times. And it creates a lot of resiliency for the countries in which we serve. So I think it's important for us to continue to work as a coalition to advocate our importance, not, as something that we should be being begged to come in with this approach, because it adds a lot of resiliency, especially to peri-urban and rural communities where we want people to stay and not crowd in urban developments and not come in and exacerbate infrastructure overload. But that's going to require us having, larger cat managed reserves. And one of the things that I think we also offer in times like this is we have a robust supply chain and distribution channel that's set up for all these decentralized systems. So how can we coordinate with healthcare facilities and education needs, and perhaps what all of us should be looking at is sort of the overlay of different products and services on those supply chain distribution channels that would allow us to have more profit generating mitigation plans. But it's a complex action that we're taking, but as everyone has said, this is the way of the future, and we're committed to solving it.
Thank you very much. The discussion is becoming very, very interesting. The temptation to just go on is there. But let me ask Nat just to come in and also give us the second poll results.
Terrific. Thank you, Oswald. So if we can just quickly pull up the poll results, and then I'd like to move right into the Q&A. And so what we're seeing here from the poll from the panelists here is the most salient impact around financial sustainability really seems to be coming up as a key issue going forward. And we've heard that across the board, and all of the panelists are nodding to one extent or another. And that ties into some of the questions that have come in today that I'd like to put out to the panel. And Oswald, now you are on the panel as well. So looking to hear, you no longer get to hide behind your moderator status. So an interesting question came up as, how has COVID-19 taught SWEs to do business differently? And post-COVID, what changes do you expect to carry forward? What makes sense business-wise that you've learned from COVID-19? And so I'm just going to pass that first off to Matt Hagen, and what are you seeing from Waterfall on that?
I think, sort of seconding what Georgia said too, I think by trying to operate complex business models, it's easy for the sort of hygiene mitigation, health and hygiene focus to, not have the preeminent place that it really is needed in what we're doing, because we're trying to keep these really low margin businesses operating. And for several years, we've been trying to scale and increase our impact and penetration on that. But I think what this has shown us is the need to have that as a core business product, which has been us more towards the inclusion of those type of services with schools, clinics, homes, and walk-up stations. So I think after COVID-19, what you're going to see in our work is a lot more of the sort of soap and water service being added to what we're doing, and also chlorine distribution being a part of our model, as we want to get chlorine accessible to healthcare facilities as another way for them to have hand washing, sterilization, that's being coupled with prepaid water services that we offer.
Terrific, thanks, Matt. And that ties nicely to another question that's come up around water for healthcare facilities. Is water for institutions. So bring the question to you on how are you seeing water being supplied to healthcare facilities, to schools under this crisis, and how are they paying their bills?
Is that one to me? Because it clipped again.
That was to George, actually.
Okay.
Yeah, thanks, Nat. And I think everybody's trying to figure out whether the bandwidth issues are on our side or your side or something else. But no, it's a recurring theme, as I heard a number of the other panelists talk about, just the importance as we look at safe water in health clinics, and as we think about the front line of defense for things like the virus in the countries we're working. It's not how many respirators they have. It's focus on social distancing and proper hygiene is really the biggest area for impact. And in the areas where we're working, we've also had a shift to look at how we can support clinics and hospitals as well. Because when you think about their ability, having marginalized access to safe water and having dirty water in the hospital, you think about it from the perspective of they can't wash their hands or their equipment, but they also can't drink it. And yeah, some of the worst conditions that we've ever seen are water issues in clinics and hospitals in some of the countries we've worked. And then the other piece that also makes it as bad or even worse is what's happening on the wastewater side. Because some of the stuff that comes out of hospitals is not just sewage. And so there's been a big focus on that. We've mobilized a number of disaster efforts to mobilize treatment systems just to get it in so you can have a point of access for safe water on an emergency basis. A lot of that has actually come as a result of these strengthened government connections where the way that we do business builds credibility and it opens the conversation up to then go and see where else we might be able to add value. But yes, schools, clinics, those are all key areas, and they've been a big part of our relief effort as well. I haven't touched on that as much because that's kind of fallen more into a relief perspective as opposed to a safe water enterprise perspective from our focus. But that is a key thing, immediately going to, okay, how do these things get sustained long term? What are the financial models within the hospitals that are needing to be in place to make sure that these things are supported? And I think that all of us are well positioned in being able to go and respond to those, because the financial model for a community is easy to just kind of take over into an institution and look at how you can implement that. And it may even be easier because there's some infrastructure that's already in place that could just take it and run with it. So.
Terrific, thanks for that, George. And Kurt, I wanted to raise a question with you that had come up in the Q&A from online. So we've seen in the two Safe Water Network countries, Ghana and India, there's been lockdowns of different types, different severities and durations. And I'm sure that's been the case in many other countries as well. But one of the questions that came in is how do you counter those conditions to bring the water to the customers and as well as the staff? How do you keep the water going and make sure to deploy your resources safely to the field?
Yeah, it's super challenging. Safety first, but of course there's a challenge there. Safety for frontline workers, water safety, water quality. We've got, as I'm sure all of us do, have teams deployed in the field working. Probably most of us today are on this call from the comfort of our home, and this morning I was on the call with members of our Ghana team in villages, deploying new systems, putting in the work required to make sure that communities get access to safe water. So how do we ensure safety of field teams, equipping them with what's required and making sure that they aren't in hotspots that are going to be particularly exposed. The customers where we are operating, I think we've only had downtime less than 1% of our stations, how to ensure social distancing so that when people do come for purchasing water, that there's the right kind of controls in place that are going to prevent transmission of disease, of COVID. And also, as part of that, reinforce to the community how important and real this is. So water is a place where people come every day, and it's a messaging place as well. And, what more can we do? You've heard a lot from everybody. What more can we do to get the messaging out there about proper hand washing, about social distancing, about all the things that we all recognize is so critical if we're going to beat this disease and return to normalcy. So we do all have a role to play in really working that into our program, so that on the ground in the communities we're doing our best to message and reinforce the practices that are so important to beating the disease.
Great, thanks, Kurt. And I do want to do one last question, and then let's move it to the final remarks from Oswald to close out the session. And this one is directed to you, John, specifically. So, John, you mentioned in your comments around some of the rapid corrections and one of the questions came in is, can you detail some of the learnings from those rapid corrections?
Yeah, sure. I mean, I was speaking to that more generally across like all the businesses who are operating. I think each organization is going to have some immediate rapid corrections that they made, and then some longer term business model changes that may or may not come as a result of this crisis. Specifically to Water for Good in the context of the Central African Republic and our model, I'll narrow it down just to a couple here because of time. One of which is creating a regionalized presence. So we currently are very decentralized in our service delivery, and we're doing preventative maintenance services twice a year. So we're currently working on developing our first regionalized space, and the goal being that we can have a more responsive service added on top of just a preventative maintenance service, so we can have higher responsiveness to the communities that we're serving. Second is similar to a lot of the other organizations within the SWE, we've started to launch some more larger scale piped distribution projects. So one of the things we wanted to put into place as a result of this is we're actually collaborating with Water Mission on setting up our own capabilities for doing water quality analysis, more for decision-making purposes, because the only actual place that you can do that currently is in the capital city at the National Laboratory, and a lot of the places that we're working in. We need to be able to have our own capabilities to do water quality analysis. So those would be two that I would speak to just in the 2 minutes that we have here.
Terrific, thanks, John. And obviously this conversation is very engaging. I have a lot of people want to exchange on it. And I hope the participants can stay on maybe just about 5 more minutes or so as we wrap up. So let me turn it back to Oswald, maybe for some concluding remarks, and particularly interested in hearing from a large multilateral agency, how do you see the role of SWEs going forward during COVID, post-COVID? What are you taking away from this conversation?
Thank you very much for this great conversation. Indeed, I think quite a lot of learning and also some of the difficulties, some of the challenges that we face as we support mainly the water utilities, large water utilities. We see that the solutions lie in the smaller water enterprises. Now, for us, going forward, this COVID pandemic, the lockdown, this period has been very revealing in that everyone has had to evaluate how they do business, and how they do things. And it's gratifying to see that there are great lessons that are coming out from this. The need for the right policies in place regarding the pricing, the need for collection, action, transparency, and accountability, localized leadership. This is so critical. We see that I think going forward, decentralized system must play a bigger role in the provision of services in the rural areas as well as in the peri-urban areas. As for us in the multilateral business space, we are very open to supporting these different models. But what we need to do is to work with the governments to convince them to put in place policy measures that are going to facilitate or support the establishment or the working of these small water enterprises. You know, we see that they are very critical. And one of the things that we would like maybe to do is we already are undertaking a study of the utilities, how they have managed the pandemic, how resilient they have been. I think this is an area that we'd like to support and capture these lessons, you know, and record them, because it's a selling point for us to the regional member countries in Africa in particular, you know, to say, look, these solutions are there, these solutions are there. And we know that there are variations and iterations that, as we have heard, coming from the different panelists, you know, and each government then should be able to study what is appropriate and what can work in the different environments. So the need to publicize these successes is very important. The need to continue demanding thinking outside the box, you know, we need to come up with more robust solutions and think water as a public health priority. I like that. Water as a public health priority. Kat, that's very right. You know, we need to think outside just the water as water, but it's a public health priority. You know, then that is going to change the conversation on the table with the policy makers. So there is a business case for the SWEs, and we are in the multilateral business looking at development business. We are looking at what are the modalities, how can we support, what modalities can we put in place to support the SWEs. You know, we know that they struggle many times to access finances, and so they need to put in maybe guarantees, and we still are yet to find, I think, a workable solution. But I think this is giving us food for thought for us to investigate and look at and say, okay, yes, I think this can work. Let's channel some of these resources through this. We are going to get the much needed operational and financial sustainability in the provision of water and improving the public health of the public, of the people. I think I'd like to end it there. And unless there's any specific aspect that you want me to speak about, thank you.
No, that is terrific. Thank you very much, Oswald, for your concluding comments, and thank you everyone for staying on. Apologies that we weren't able to get to all the questions. There are many interesting ones, but really hoping this is the start of a conversation that we can continue going forward. I would also like to thank our panelists and moderators for this conversation. And I thought it's been really covered a lot of ground, and obviously there's a lot more we can discuss. I also want to give a really very special thanks to Ale Garcia Ramirez, who has been working behind the scenes to make this webinar happen. And she's not on the screen, but she's been just a huge driving force behind this. So thank you, Ale. We will be sharing some of the resources that the different organizations have around COVID-19. Don't have time to get into it at the moment. But would like to alert you to some of the upcoming webinars that are happening. This is the start of our webinar series. Water Week is coming up next week. Some people had asked questions about the free water mandate, and we're actually having a webinar about that in September. And then, of course, we'd like to invite everyone to our virtual youth convening on September 3rd. These are the topics we'll be covering in Q3, and stay tuned for more and bigger in Q4. Additionally, if you have follow-up questions, I'd like to share some of the contact information, and we'll be distributing this to everyone on this call for you. So lots more to talk about, but thank you very much for joining, and hope to see you at future events. So in the meantime, stay safe, and we'll keep on discussing small water enterprises and their scaling and sustainability. Thank you all.